Dr. Christy Ennis. Thank you so much for tuning in today. We are going to go over how to get rid of some back pain quickly in the flashiest of flashes. One thing I do want to mention before we get started today is that there is a charity called One Mission that is near and dear to my heart because I have a friend whose son is going through leukemia for the second time, and they really help out kids. So I'd love if you would be able to make a donation. Any amount, it doesn't matter, any amount would help. So thank you for that. And let's get started with our first technique. Okay, tip number one is to change positions frequently and move. Now we were all taught not that long ago, right, that sitting is the new smoking. I actually am stealing my husband's statement in that it's not sitting is the new smoking, but stagnation is the new smoking. So not moving. What research actually shows is that we need to change positions every 10 or 15 minutes, which is a fair amount of time to help counteract some of the pressure that's going through the spine. So they've done studies where they decided to have people stand on up, and they found that that didn't make any difference in their pain. Because again, standing in one spot isn't really that much better than sitting in one spot. So like I said, the key thing here is to move and shift. King Julian had it right in Madagascar. I like to move it, move it. So what does that mean? Really stupid simple. Keep it simple as you can. So like I said, every 10 to 15 minutes, that means even sitting with perfect posture, like you could balance a book on your head, isn't great for a long period of time. So if you are sitting, literally things like marching, right? Think about even engaging in through those abs. A little leg extension, right? You're gonna get those hamstrings loosened up a little bit. Get the blood flowing. Lotion is motion. If you happen to have a band, you can even do this if you're taking a Zoom call because no one will see your legs. And you can even add in a little bit of work this way. Again, nothing doesn't have to be draining, but if you could do a little bit of something like this, like I said, every 10 to 15 minutes even, and I know we can't all do that, but that would be great. Now the other option then, let's say we are standing for some of the day, even an exercise where you're going sit to stand, right? If you do a few repetitions of these, even with a little band, now we're getting those glutes going so we can get rid of dumb butt syndrome, or it is sometimes also known in not as nice of a term, syndrome. So, and if you are standing, like I said, just move, right? Little hip abduction, trying to work on getting those things moving, or I should say activated, that haven't been moving that working that much. So hip extension is another nice one. Those glutes just tend to want to shut down. So a few repetitions throughout the day is going to save your body. All right, tip number two is leaning into your position of comfort. Now, what the heck does that mean? It's just like a lot of words jumbled together, right? No, not the case. Depending on what your diagnosis is, usually, and again, everybody can be different, so keep that in mind and talk to your doctor first if need be, but there are certain instances in the back that respond better to specific positions than others. So, for example, stenosis, right? That arthritis in the spine usually does better with flexion, so kind of bending forward. If you're sitting, one of the ones I really like to do is kind of lean on down and just let yourself hang, honestly. You don't have to get all the way down to the ground. There's nothing that says you have to do that, right? For a disc herniation or disc bulge, those are going to be the two most common terms you hear. Typically, again, not always, but typically it's the opposite. An extension feels better. So that would be if you're standing, right? Making sure you're breaking out of that seated position. And even again, doing some of these leg extensions can really help. And it's hard to do sitting, obviously, so I do recommend you try to get up. The other option, if you do need to get a little bit more extension in through that back, is if you get onto your stomach, not go night-night, but actually do some little press-ups here. Again, no pain. Sometimes this helps, again, to get that reverse motion. Now, I'm going to go back into that chair again. If, like I said, it doesn't even have to be stenosis or a disc. Maybe it's a muscle issue or a joint issue, but you know that one position feels better. Our bodies are really super duper awesome at telling us what actually is the right thing to do. So besides that bending forward one, if you know that bending forward feels better, guess what? Flexing the hip also feels better. So sometimes just pulling this knee in or even doing a little stretch with that cross leg opens up that hip joint. But like I said, flexing the hip actually helps to flex the spine as well. And clearly make sure you do this on both sides, and you should hopefully be feeling better. Now, again, if extension is the better position, right, then you want to focus on doing things that ease into that. Tip number 3 is actually getting some soft tissue releases in the muscles that attach to the spine and therefore can pull through that back. Now, these muscles oftentimes people don't think about because you don't look at it and go, oh, back. But I'm going to explain that. So first group of muscles, those hip flexor muscles, actually come all the way right into the top of that hip crest, over towards that belly button, and dive deep to attach to that lower part of the spine. And that's a couple different hip flexor muscles that do that. And I'll show you a picture here. And so it is important, because they do attach to the spine, that if they get tight, they're gonna yank us, right? We don't wanna be yanked anymore, regardless of what is going on in the back. So I'm gonna take my Derma Edge out, because this is the easiest way for me to kind of get to these muscles actively. If you find the top of your hip, and there's a couple spots here, okay? So if you kind of go right to the top of that hip and woo, down a little bit and dig in, oh my, that's it. So from here, I'm gonna take the edge of this Derma Edge, and I'm actually gonna rotate that leg out a little bit. And you go, ooh, ah, hopefully. So you do this until it feels a little bit less tender, okay? You can move on down the leg to where another one of those muscles is. Actually, the rectus femoris tends to also act as a quad muscle, so that one gets tight too. For me, that tends to be, again, if you take about 3 fingers from that little hip there and come on down, that's usually where the spot is. Now you can poke around, right, to see if it's a different spot, but then, yep. Whew. Good thing I've got so many issues, you guys. And you're gonna add that little march in, same idea, until you go, oh, hey, that doesn't feel nearly as bad, okay? And don't worry if you can't find the exact spot. Literally just poke around near that hip, and if you find a spot that's sore, it's probably part of one of those hip flexor muscles. The next muscle is your gluteus medius. That's a fun word to say, right? So if I'm tracing kind of the top of my hip, that muscle fans down here. And this is a giant culprit for getting pain right down here. Don't hit yourself like I did. But to help eliminate that a little bit, again, using the edge, this is, I find, easiest to do standing. You have a couple options. You can take and rotate that leg in and out. Whee! Yeah. Or even add that little bit of hip abduction. Okay, so bringing that leg away. And again, it should feel kind of sore and then kind of better, kind of sore, kind of better. Same idea with do it until it does feel a little bit better. The last one is for this giant low back muscle that attaches to the spine, the ribs, and the hip. I don't have a whole lot of space there because my hips are pretty high, but that is where they do attach, that attaches the quadratus lumborum. So to get to that bad guy, we're gonna take a tennis ball. I'm gonna lie in my model pose, not all the way on the sides, and rolled back a little to get into that space where that muscle is. Sometimes even just doing this and rolling back and forth is enough. If not, I find that taking that bottom leg and kind of bending it up and straightening it out, you can even add a little rotation with it. Woo, we'll get that same kind of active release going. And again, it's not timed, it's not repetitions, it's until it feels a little bit better, and clearly make sure to check both sides, because a lot of times it's not just one side, it's both. Our last tip for today is tightening up the core. Now, core, I had somebody tell me once, I love this, is like a green leafy vegetable. You just can't go wrong. Now, what the heck does that mean, though, really tighten up the core? That's a phrase that's thrown around a lot, and there is debate about what consists of core muscles. So, to make it a little bit easier, I like to tell people, really work on those hip and butt muscles, those abdominal muscles, a little bit of those back, and I actually like those lats too. Now, one of the best ways to actually work on this and to help with pain, regardless of what the cause is when you're going to change positions, think about abs, butt, and a little bit of that lat. So if I were to go from a sitting position to a standing position, I'm gonna think, squeeze those butt cheeks, gently, right? Pull in that belly button, and I'm gonna dig my elbows in to help engage through here. So getting support through the back, up above a little bit, come closer to the edge of my chair. So here, and stand. Try not to hold your breath when you do this, right? That doesn't help. And it's okay if you can't get all the muscles, even sometimes just squeezing in gives you that little bit of extra support. I'm gonna show you a few exercises lying down too. Get my graffitied folding chair out of the way. So a couple of the ones that I really like people to do are the frog bridge, so feet together or heels together, toes open. There's no place like home. You're gonna keep your hands down, do a little bit of a pelvic tilt, so you're tucking that tailbone under, and then coming up. So now we're actually activating those bum muscles and helping to stretch those hip flexor muscles, which we talked about before, right on open there, okay? So 10 to 15 reps of these if you can. To get those abdominal muscles going, especially those lower, deeper ones, remember what I said before, just try to think about just gently pulling that belly button in and keeping your back in a position of comfort. And then level one is really just kind of adding this little march. We're working again on keeping everything nice and steady here as we're moving those legs. And if you want to make that even harder, you can do a single leg and lift. And now we're working some of this hip also. Or even harder, without shifting or blooping that tummy, and then adding a little tap down here from the hip. And it is okay if you do not tap all the way down because you don't want to do this. We're not a rocking horse today. All right, so there's some nice, easy exercises to add in to work on that strengthening component as well. Thank you so much for tuning in today, you guys. If you want to get rid of pain anywhere in your body on your own with just one little portable device, don't forget to check out the Derma Edge. I created this while I was going through Lyme disease to help get rid of my pain on my own, nice and gently. It's patented and made in the US, actually right down the road in Laconia from where my office is. So don't forget, you can click the link here or in the description to order your own.